Hi, and welcome to What Am I Modeling? Today, my guest is going to change the world. You are not going to believe this. For any of you that have children on the spectrum, for any of you that have been given a chronic diagnosis for yourself or for your child, this is the episode to watch. Dr. Lauren Stone had a diagnosis for her son of autism, and this was severe autism, like he was going to be institutionalized. It was genetic. There was nothing that could be done. And she said no. She quit her job and she started to learn more about the body, more about the immune system, more about the brain, and what we could do to modify it. And she reversed her son's autism. He is now a thriving adult with a family, an amazing job. And she went out and started a career to help others do this as well. It is empowering and inspiring. And as she says, her words of the episode are hold on to your vision and trust your intuition. It is my absolute pleasure to introduce Dr. Lauren Stone. Hi, Lauren. Welcome to the show.
Hey, thank you so much for having me.
I am really looking forward to talking to you today because autism, any sort of childhood, let's call it a neurological, psychological disease, is so rampant right now. And we're out in the world seeing, oh, it's the food. Oh, it's the toxins, right? It's the vaccines. Oh, it's genetic. Oh, it's this or that. Oh, there's nothing you can do. We have all this stuff. And I have talked to so many parents over the years that are so bombarded with information and don't know what to do and just kind of go by the doctor's recommendation. And I want to dive into your story because most people won't do what you did
Yeah. Yeah.
and really just be like, you know what? I'm going to trust my instinct. I'm going to just drop everything because I believe I can make a difference. That is a really brave and risky thing to do. So I'm excited for the audience to hear what you did with your son. And I want to just kind of dive right into that story on what exactly this baby's born, you're told this or that, and how did this start to go? And we'll just kind of unfold as we go. Does that sound good?
Yeah, 100%. Yeah. So I was, young when I had my first son. I wasn't even 30, so it wasn't like a geriatric pregnancy or whatever, which is so common these days. I was healthy. I ate really well. I did everything right according to the books, right? And I read a lot of books, obviously, trying to be really healthy. I didn't have any medications at the birth. I was just like really, really cognizant of what I needed to do. And birth went well, everything was fine, but, shortly after bringing him home, he started to sort of manifest with these, what we call soft signs, right? Extreme colic, for example, something that the doctor is going to say, oh, that's normal, things happen, right? But he would like scream and writhe literally for hours on end in so much pain. I knew it wasn't normal. Like, that's just not normal. He would have ear infections. He actually didn't have a formed stool until he was about 4 years old, which is remarkable now to think about. But, back in the day, it was just like, yeah, just a little bit of loose stool. But, nobody listened to me.
What year was this?
Yeah, this was, sort of mid to late 90s, that would.
Okay. So at that point, compared to now,
Mhm.
there was awareness, of course, of these disorders and stuff, but it wasn't as, I guess, hyper focused as we would see as a baby being born now,
Exactly.
correct?
Exactly.
But these are things like, oh, your kid has an ear infection. Oh, that's normal. Here's an antibiotic. Oh, yeah, they have loose stools. Maybe change your diet type thing, right?
Not even change your diet. This is the thing. Really? No, I mean, he had colic and they didn't even talk to me about diet. Like, it was just crazy town. So anyway, long story short, he ended up having seizures around 18-month mark. We eventually we brought him to a variety of doctors and neurologists and whomever, and nobody could figure anything out. He started manifesting with really extreme sensory issues as well, and like hand flapping, and the world was just too much for him. It was like painful. I would say his sense of hearing the sounds were the worst because it was hard for him to be out in the world. It was so painful. He'd constantly be like this, and you can imagine how that would cause you to retreat into yourself, right? So
Yeah.
Anyway, he was eventually, we took him to the Yale Child Study Center for an official diagnosis, and they did diagnose him with autism. Um,
How old was he at that point? 18 months?
4 at that point, because
Four.
well, I'm telling you, nobody, like, this is back in the day when they didn't diagnose the autism because they thought that kids at that point, if they had autism, they wouldn't love their mother, like there was like the refrigerator mom theory was still rampant. No, I'm serious. It's just was
Oh my God,
crazy.
tell me about that. Really?
Yeah. Yeah. It was really hard to get a diagnosis. It was really hard. And in fact, like, it's a funny thing. Most people would think, oh, what a terrible thing to get that diagnosis and it must have crushed you. Not me. Like, I was so happy to have a point of departure to do something, right?
Yeah.
I had no direction until I knew exactly what was going on, right?
Yeah.
So we got the diagnosis and I was told that basically there was nothing I could do, that he was going to continue to regress and eventually be institutionalized. And yeah, that was it, right?
So it was considered a severe autism diagnosis. Like, this isn't a mild case. This is it. Like, this is the life now. There's nothing you can
Yeah,
do.
prepare. They were like, prepare your finances. He's going to be, you know what I mean? You have to have funding for it, the whole thing. So, of course, I'm not that person. So I was just like, are you kidding me? No, that's not going to happen. So I just quit my job and I went back to school and I studied biochemistry, I studied nutrition, I studied homotoxicology, which is a kind of homeopathy. I just followed his lead. Anything that I thought he needed, I couldn't find anyone else out there to do it, so I had to do it myself, right? So I became his medical practitioner and I just worked my way through all of his symptoms. And really the the big discovery for me was that in order to understand what the symptom is, you kind of have to reverse engineer it and figure out what the source is, right? And I don't think people really think about it in terms of that, but that was the key for me, was really understanding the why behind, the seizures, the hand flapping, the this, the that, the loose stools, that all of it. And once you understand that, you can sort of gently peel away the layers of whatever toxic influence caused it, because really it's just an immune reaction, right? To something. So once you isolate what that something is, you can peel it away and the symptom will recede. And, lo and behold, by the time he was 8, he had lost his diagnosis, right?
It's insane. I have a family friend who has an autistic daughter, and she's already pretty much institutionalized. And I mean, she's school
Hmm.
age, right? Or definitely can't be left alone, like very, high level autism. And it's interesting. And I don't even know. I'm trying to think of the question even to start, because obviously, as a naturopath, we look at it and we say, okay, we need to look at the diet. Okay, we need to look, obviously, we're looking at the toxins and whatever. But even within that scope, each case is so individualized that even these parents out there that are seeking help, it's not an in the box approach. Even if, you've got the ones that say there's nothing you can do. And then you've got the functional and naturopathic doctors that are saying, yeah, we can do something. But every single kid is so incredibly different. And that's so overwhelming. That's so overwhelming for the parent to take that risk. And I mean, especially leaving your job, you had to trust that what you were going to do was going to work out in whatever way it meant to work out. How did you, I mean, you're a female, but how did you get the cojones to do that? Were you like that as a kid? Where you just were like, screw it, I'm just going full bore, or what? Where'd that come from?
I think that I just didn't, I mean, so it took a lot because I grew up in a medical family. My mom was an oncology nurse. I was taught to revere doctors. And I think what happened was I felt so abandoned, like so let down, that, it was that I finally was just like, I have to fire my pediatrician. I have to fire everybody because they're not helping me. They're not listening, and when the going gets tough, they run, right? And the other thing is that, I was already in graduate school getting a PhD, so I knew I could do it. I like school. I like studying. I just had a confidence about that. So, That wasn't an issue for me. So I guess it was those two things, but also more importantly, it was just that, no one's going to tell me that my son isn't going to thrive. Like, who are they to tell me that? It's just not going to happen. So
That's
yeah,
great. I love that. I love that.
yeah. I mean, I think a lot of us feel that way. I mean, if you're in the world of having kids with chronic illnesses, the amount of gaslighting you get, the amount of like, it's heartbreaking. It's really heartbreaking. So at a certain point, you got to learn to trust your instincts, trust your intuition, and just move with that because that is where the healing is. I mean, 100%. Like from my perspective, I have a practice where I help, kids, not just autism, pandas, Lyme, all of those chronic, conditions. But the one thing that I teach more than anything is that the parents hold the magic, right? It's not me, right? The healing happens in the home, and they are the ones who are, they're the ones who are doing the work, right? And that's where it has to happen. There is no magic pill. There's not. It's not.
There's never a magic. Well, the magic pill is in you, right? And before I dive into some of the little things and the commitment you made, because I really want to hear more about how you did this.
Mhm.
How old is he now?
He actually just turned 30. He's married. He's got a PhD from Brown. He's like the head engineer at a startup company out in Chicago. You would never know he had autism. You would never know he had a seizure
So, do
disorder.
you think he had autism?
Oh, yeah, he did. He remembers.
The reason I say that is we're so quick to put labels. Well, your kid has ADHD. Oh, they have this. But then when it goes away, the question is if autism is genetic, if it's a diagnosis that's irreversible, and
Hmm.
he had autism and now he doesn't, so does that mean he had a genetic, autism? Or was he just toxic? Was
He was
his body's, you know what I mean? Were his metabolics just off? Do you know what I mean? Like, we're so quick to throw
100%.
these general labels. And I think that's part of the reason why it's so hard to treat is that we're throwing one general label across this huge spectrum
Hmm.
of different symptoms that have different root causes and different genetics behind them. So I would argue he didn't have autism. I would argue he had a condition that looked like autism or his body responding to toxins, but perhaps not the traditional old school definition from way back in the day in the Merck manual of what autism was or is. It's just, I was curious your thought on that because he obviously is a high functioning, normal, wonderful,
Yeah.
successful man now.
So here are my thoughts. So from my perspective, the vast majority of chronic illnesses are really all the same thing, just manifest differently depending on the person, right? So the equation is really, yes, genes, a genetic predisposition or an epigenetic issue, right? Plus environment, what is going on in the environment, plus any infectious exposures, plus immune function, right? And if the immune, really, that's the real issue there. If the immune system is overwhelmed, then you are going to end up with symptoms. If the immune system is able to deal with the stressors, then you survive and thrive, right? So autism is the same as asthma, is the same as ADHD, is the same as cancer, is the same as Alzheimer's disease. They're all the same.
I
It's just
agree.
manifest differently. There's also, and there were some, I had to find the studies, but I did stumble across something years ago where they compared, Alzheimer's to autism. And, because they share so much in their, the neurology, the symptomology, whatever. And it was determined that given the genetic profile, that if you took an 80-year-old with Alzheimer's and they were born today, they'd have autism, and vice versa. If you took a child with autism today and they were born, 80 years ago, they would have been fine up until a certain point because it's a total load thing, right? It's all about the accumulation of stressors and when that tips over into symptom expression, right? So autism it is an amalgamation of symptoms. That's all
Based
anything is.
on internal stressors, which is speaking my language. I get so excited when we start talking about stress.
Yeah.
Get me lit up. But it's internal stressors, and what those internal stressors are vary. And then you add external stressors, which I think, kind of looking at the idea of perfectionism and labeling and living by external validation, I think often what happens is that a child gets labeled with whatever.
Hmm.
And then they just jump into that mold. They're like, well, I have a disorder or I have this or that. And the parents like, well, they just have autism. There's a, and it's like, and then we have an external stressor to keep up with whatever box we've been put into to add
Hmm.
more internal stressors. And it's kind of this vicious cycle where if we just said, this is how the kid is, what are the symptoms that we're
Hmm.
experiencing? And let's break these down and we'll see, is there any way to modify this behavior? So, is there kind of like a timeline of what you started to do?
Yeah, yeah, 100%. 100%. So, and look, this is not what everybody should do. This is
Right.
what I knew I needed to do for my son. So first and foremost, he had had loose stools forever. I mean, his nutrients were so depleted. So, I started out with giving him amino acids and vitamins, but mostly amino acids is where I started because I knew his neurotransmitters were off. Everything was off. And, what is the most basic thing we can give, right? Amino acids are the building blocks of proteins, which we need for pretty much everything, right? So I started there and, I looked at it like, it's like pre-digested food. So his tummy was not working. So it bypassed all of that dysfunction, right? And really within a week or two of starting with the amino acids, he changed. Like he became much calmer. It just was remarkable because you know what? Our bodies are hardwired to heal. We just need to give them the tools. And and especially with kids. So even that one little thing changed him remarkably. And then we went on, I mean, I had to fix his digestion, so we had to take out all the toxic foods. We did food sensitivity testing. He
How
had
did that impact your entire family? And I bring that up because this is one of the biggest objections I get.
uh-huh,
Well, if we remove all the food, like even me, I have a child who's a bit, he's a bit hyper. It's fine. I like him. He's fun. But he goes to school and they load him with cupcakes and candy when he does
uh-huh,
stuff well, despite me saying, look, I don't want him to have that.
uh-huh,
There's
uh-huh.
a lack of control there. Did you run into pushback when you started to remove those foods from the environment?
Not from him,
Not
no.
from him, yeah. From others. Because, I mean, then
Yeah.
you kinda become the mom that, like,
Mhm.
is in everything, and they're like, "Oh, that's the mom that doesn't allow cupcakes."
Yeah,
Just from
so
personal experience, just asking for a friend. How did you
yeah,
do
no,
it?
no, it was but I felt like, I was already that mom. I'm just, you know, like, it's hard to run away from who you are. Like, I was already, a little bit out of the box. So, it didn't really, yeah, that I did run into a lot of pushback but you do what you have to do, right? You just do what you have to do.
If you believe in it, and I think that's where a lot of people, they think, "Oh, it might help, but maybe it won't," and so they stop. But, okay, so you clean up his food, you start working on his digestion, you're giving him the nutrients back, you're seeing differences quickly.
Well, 100%. Yeah. And then for him, the hyperacusis was really significant. Like he couldn't he had a lot of like he had sound sensitivity, but he also had issues with processing and all of that. So, in addition to well, look, I had to figure out what's going on in the brain, right? And what I realized was that he was actually mercury toxic. And the reason I know that is because I had a mouthful of amalgams when I was pregnant. It all crossed the placenta. And then he was given vaccines with thimerosal. We did testing and his mercury levels were through the roof.
Yeah.
So we had to,
It's an interesting, I don't wanna call it an argument, it's an interesting perspective because a lot of people think when we talk about the vaccine argument with that, they think we're just talking about the 1 dose of vaccine.
uh
Most of the time is that they're already toxic. They already have such toxic load and it's like the icing on the cake. And that's so when they get in that argument of, well, my kid had it and they didn't get it, so therefore it's not causing it. It's like, well, wait a minute. You're looking at this on such a small scale. If the child is already toxic and they're nutrient deficient and they're already, set themselves up, it's just that icing on the cake that the body needed to take it full bore. And so I think that's a very important point coming from
100%.
you and the mercury in the mouth.
hmm Yeah, 100%. 100%. And
How did you determine the mercury toxicity? Was it urine? Did you do a provocation test or did you just do how did you do it?
we did a hair test when he was little, and because if you save the baby hair and you send it in, right when they were being vaccinated. At that point, you can see if there's like a mercury kind of pushing out. It's not 100% accurate because for some kids,
Yeah.
they don't push any out. So you're not going to necessarily see that, but we did see it. Yeah.
That must have just been, I mean, as a biochemistry person myself, I would have been excited. I would be like, "Oh, we found it. Okay. Okay, let's do this. Let's get rid of this mercury. Let's see how far we get." And then it is easy to commit to the diet and it's easy because you have a reason, right?
Yeah. Yeah. Yeah.
And they don't run that. Most pediatricians don't even, I mean, you get laughed at if you ask for a mercury test, right?
Oh, yeah. Yeah. But they don't, I mean, we could go down a rabbit hole with vaccines and I don't want to do that. But
No, yeah, I mean, this is just general. I mean, in general, it's just a back
yeah,
and forth. Yeah, absolutely. But they don't.
there's a belief that there it really isn't any metal in the vaccine, or if there is, it's like a
Mhm.
tiny little bit. And all of that is not true.
Yeah.
Yeah. I mean, it's a major issue for our kids.
And but they won't test. I mean, I'm saying most doctors won't even test to see if mercury is an issue. And imagine what would that create a different picture knowing if the child has a predisposition or has toxicity going into that. It would just be interesting, right? When we talk about preventative health, what are some of the things we could do? So as
100%.
you're learning this, it's just so cool to me because we say, well, there's nothing we can do. We never know. It's arbitrary, but maybe not, right?
Right. Right.
And a hair test is what? A couple $100?
Mm-hmm. Mm-hmm. Yeah. No, it's not a big.
Okay, so we do this, we find out there's mercury.
Mhm.
So how did you support that and clear that?
So I was super, super lucky to have partnered with a naturopathic physician who was well versed in homeopathy and helped me to formulate, like, she did it. I didn't, but she
Yeah,
taught me how to formulate these kinds of protocols where, you're supporting the nutrition, you're opening the pathways of elimination, and then you begin that gentle detox with the homeopathics and with whatever other, support, binder support. We didn't call it binders back then, but,
yeah.
you know, EDTA is a binder, really. You know what I mean? It's a chelator's binder. So things like that. So that's how we did it. But I think the other thing that was really, really key for me is that I learned how to muscle test early on. So I muscle tested everything every day. And I didn't give him the same thing every day. I switched it up depending on what his body needed. And that, is key. Like it's food too. Like some foods were good sometimes and sometimes they weren't. And you know what I mean? Like it's just, I think that that's an added layer too that was really helpful. So
So if
between,
someone's watching this and says, "What is she talking about? Muscle testing," right? So I'm assuming you had him hold a food in one arm and pushed on the other. What did you do?
I did O-ring testing, which I like much better.
Okay, explain
Mhm.
that.
Yeah. So it's the same thing that, when the body recognizes what's good for it and what's not good for it. And when you bring something into the field that it has a negative impact or draws energy from the body will get weak. And you can test it with muscles, right? So you can test it with the arm testing. I prefer O-ring testing, which is, you hold your hand like this, and then the practitioner, you get a strong ring and then you put whatever in the field and then you test it that way. Or you can therapy localize for different
So
organ
as far as
systems.
trying to open the ring, is
The
that what you mean?
practitioner would open the ring. So,
Yeah.
yes, that's how we
And
would.
they're holding the item in the other hand per se, or just somewhere
Just
in their
holding it or
general
you put
field?
it, yeah, somewhere
Yeah,
in the field. Yeah.
that's so cool.
Yeah, it
I'm
was.
gonna start doing that with my kids. I mean, I'm familiar with muster testing, but to be honest, those are some of the things you learn and you don't always use, and it's something so easy to
Yeah,
do. So you started adapting based off the muscle testing. I thought.
did. And because my whole, I was leading with the fact that, again, our bodies are much more brilliant than we are. So it was following his lead. Like, what did his body need? You ask the question and you get the response. So yeah, it just cut corners and was able to make it a little more tailored.
He was in school at the time or no?
Hmm. Yeah.
Were the teachers noticing a change pretty quickly? How did you get support as a mom going through this kind of on I mean, it's a very lonely journey.
It's very
Were
lonely.
you getting the support around you at that time?
I was really, really, really lucky in that, he went through the system before the huge influx of lots and lots of kids with autism and lots of kids with special needs. So he did get more support. He had his own aide, for example, for years.
Yeah.
And, the school system at that point, they allowed me to be there a lot of the time to oversee things. They allowed me to put, an air filtration system in the classroom, things like that, because he's so hypersensitive to everything that, schools are notoriously moldy and awful, right? They have wall-to-wall carpeting, they have, like, all of that stuff, so try to keep it as clean as possible for him. The other thing I did was, I have to say, he was only I put him in school, for socialization reasons in the morning, but then I would pull him out in the afternoon because the services at the school weren't good. So I brought him far and wide for speech, for whatever else we were doing, mostly speech at the time.
Yeah. And you're right. Now the schools are inundated
Mhm.
with this. I mean, so can I ask your viewpoint on why now do we have so many children with autism?
Because the world is that much more toxic. And the problem is, really, our kids are born at a disadvantage, right? So they are born having, you know, absorbed or been gifted all the total load, toxic load of the mom, right? So they come out already really, really fragile. And then they're born into a world that's not conducive to health. So really, it's a lose situation. And then you couple that with the fact that our soils are so depleted that we're not getting the nutrients we need. So we're not fueling our bodies. We're not, we don't have the energy resources to do the work we need to do to be healthy in a toxic environment.
Yeah, and we're born into stress as a
Mhm.
constant stimulation with kids sitting on phones and YouTube, and their brains are being bing, 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 quick, 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 which of
Mhm.
course then changes their digestion. They can't absorb the crappy soil anyway, and then they become more nutrient deficient and they don't learn how to access their parasympathetic nervous system. And I think I agree with you. I think those two things together, born into a very toxic world that isn't conducive to health with poor nutrient status to begin with, and then you add the sympathetic nervous response.
Mhm.
And I think this is a new normal. And that's why I do wonder, are these labels helpful or not? Or do we need to just start going back to learning how to be calm, how to
Yeah.
navigate when something comes up, looking at, oh, why might this be happening? And then
Mhm.
switching it. Oh, he has diarrhea every time I give him this formula. And instead of listening to the gaslighting, well, we should just give more formula or just switch to a different brand or the allergen brand, which still has the same crap in it. Why don't we say, wait a minute, maybe it's the milk. Maybe it's the additives, the corn syrup.
Mhm.
Maybe, like, do you think we're getting to that point in health where we're starting to get a pretty major tipping point here? But you're such a testament to when you stop and you step back and you say, wait a minute, I'm going to use my logical brain and try to figure this out. You can get success.
Yeah.
And I think our kids are being born into a world where we're not supposed to use our logical brain anymore. We're told what to do. We're just saying we do this because all this information is saying this is how we live, this is what we do. I say often that I feel like I live in the Matrix,
Mhm.
or like where everything that I do is being manipulated and controlled by something outside of me. And it takes me actually recognizing it and saying, wait a minute, this isn't what I want. This isn't right. How
Yeah.
many people actually question that? And I think you said, hold your vision and trust your instinct.
Yeah, that's so important for parents. You're the only one who really knows your child. There's nobody else who understands what's going on. I feel strongly that, we're taught to give our power away, to
Mhm.
give it to the doctor, to give it to the pharmaceutical. You need to take it back, right? And trust that, you have what you need, right, to do the work. So,
Take your power back.
mhm.
If you gave it up, take it back. It's
Mm.
so true with everything, even our own health. I know when it comes to our kids, sometimes we commit more because we care so much about our kids' outcome, but we don't do that with ourselves,
Right.
right? We live years and years and years with Hashimoto's or with, stomach issues or chronic constipation. I had a patient the other day, went into the GI. She has constipation. We've been working on it. It's been getting better with things that are supporting the nutrition of the body and the digestive function and toxin removal and all the things you talked about, it's getting better. It's actually getting better faster than anything else she's tried before. But she goes to the GI just for the routine colonoscopy or whatever. And they're like, well, here's this medication for IBS constipation. It's a miracle drug. And I'm like, wait a minute.
Mhm.
What? Like, thank goodness she questioned it. But when she questioned it, she said, well, how does it work? He said, oh, it's just a miracle drug. Everyone I give it to, it just gets better. And I thought, well, you don't even answer the question. So I
Mhm.
do. It's such a story of, and I don't want to say that there aren't amazing, really conscientious doctors out there. I'd like to think
Yeah,
I'm one, right? There's a lot of us out there and the world is changing. But I think as the parent or as the person who's being gaslit, you have a choice. You either trust your instinct, hold that vision and trust your instinct and go against it and just have faith that every step you take towards that outcome is either going to get you there or is going to open the door to the next step, or
exactly.
you retreat and you just follow what everyone says. And then you're either in the same place that you were 5 years later or
Yeah,
always wonder, even from when I was younger and I started was looking at what I want to do for a career, I was so interested in behavior modification. What makes one person choose, I'm going to take action, I'm going to take a risk, and the other person to say, oh, no, 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 no. What is it? What is it that makes that difference? Do you know? What is it in you? Spunk? What is it?
I think when somebody tells me that it can't be done, I need to do it,
Yeah.
especially when it's my kid, you know?
Yeah. Did you have more children after that?
Yeah, I have three kids.
Oh, good. Were the mercury amalgams out at that point?
No, I didn't get them out until afterwards because I had them right in a row. So
Okay.
yeah, but so my other kids are a whole nother story. You know, they all needed work as well. And that is advice I would give every parent. If you have one child who's manifesting early on, treat the rest of the children the same way because they all, again, it's it's just going to manifest differently. It doesn't mean it's not still there, right? So the same predispositions, the same environment, whatever it was, right? So
Great point. Are they younger? He
they're
was your
younger. Yeah, he was my oldest. Yeah.
so yeah, so you started treating all of them.
Hmm.
It's great
Yeah.
because you're right. I mean, they came from the same body, right? So they all were born with the same environmental predisposition, essentially. Different genetic maybe, but similar.
No, 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 100%. And, you know, the apple doesn't fall far from the tree. Like I had to treat myself too, right? You know, I had mercury toxicity, right? I had also lead toxicity because I lived in a old house that my mother was constantly redecorating. They'd be in there with the sanders, you know? And I remember feeling like, oh, you know, I have to get out of here. But yeah, the exposures are pretty intense. Even though I wasn't symptomatic at the time, like it was in my body. You know, you really are. Woman is really never cleaner than after she gives birth because she gives it all away, right?
And I think we are symptomatic. I just think that back when we were kids, it was just like, oh, that's their personality or that's just them. They'll figure it out. Like it wasn't jumped on the minute that something,
Yeah, yeah.
acted out in school. It wasn't like, oh, we got to get a diagnosis. It was like, yeah, she's just being stupid. I
Hmm.
think we do have those symptoms that maybe we just don't recognize or we don't recognize them until we're older
Right.
and we have children or start to experience our own health problems. And then we don't even look at toxicity as the case. So now, what do you do with your day every day? What do? You help other people with this.
Yeah, I do. I have a private practice in homotoxicology and nutrition. So homotoxicology is really all about the interface between toxins and the human body. And we use, you know, it's really gentle homeopathic detoxification protocols, but all of mine are very bio-individual. So it's a marrying of, you know, sort of biochemistry and bioenergetics, right? And I think that is a beautiful way to, you know, nourish the body and to re-educate the body and to heal. And to your point, I feel that or what I see in my practice is that, you know, our bodies have been so assaulted. It's the toxins that we see, but it's the toxins we don't see, you know, like the electromagnetic frequencies that are changing the hard wiring. So we don't get out of that fight or flight place, and you cannot heal until you get into that place. And so there's a real deep re-education that needs to happen. in the immune system and elsewhere. And homeopathics are just a beautiful way to do that because they are they're like an instruction manual, right, for the body. So I love it. And they're great with kids, great with adults. They're gentle. So yeah, so that and the other, my other hat, I have a private practice, but I also do a lot of educational outreach. And this is my passion. I teach parents to do what I did. And I teach parents how to take back control of their families' lives and health and how to become, their child's health advocate and to actually do the work that needs to be done to heal their children. So that's the other thing that I do.
Have you seen a lot of other dramatic stories such as your son's?
Yeah. Oh, yeah. I had
That
friends.
has to just, like, warm your heart in such a way,
Yes. So,
watching the parents that took that risk and were like, "Oh my god." That's a life changer for an entire family.
I had just like 3 weeks ago, I had a call with a family who started with me in January. And the son, he's like 3, I think, 3 to 4, nonverbal autism, very hyper, constantly running, like wasn't able to sit down, wasn't able to attend, wasn't engaged or, didn't couldn't socialize, none of that. And literally within the 4 months, we had our appointment in May. He went from that person to a child who started speaking, who was able to go to school, who started to try to make friends, who was able to start to play with figurines and wasn't spinning. Like, I mean, just an unbelievable amount of of change. And not hyper at all. He was set in circle time. It's unbelievable, right?
Is
And
there a
beautiful.
point where it's I don't wanna say too late, but, like, let's say that someone's watching and their child is 10, 11, and they've been diagnosed with autism and they've had all these struggles and whatnot. Can you still make a ton of progress the older the person gets? What if this person is 20? Like, does it matter? It's just about reversing it? I mean, obviously, younger, there's less to reverse, right? Because you have more
Mhm,
toxic load.
mhm.
Is it still doable and possible? And can you still see a complete resolution, or does it get less likely the older they get?
So I think you can always create change. And, at a certain point, it's about taking one symptom at a time and trying to, um, you know, reverse engineer that symptom. When they're older, it's a little bit more difficult, obviously, because, you know, our bodies get used to doing things a certain way. And so it is harder to reverse that. It's not impossible, but it is less likely that you'd see a complete reversal, but you can always make things better. Yeah.
Yeah. I mean, the sooner you jump in, the sooner you get results, right? Whatever
Mhm.
those may be. This has been so enlightening. And what I hope is that people listening realize that you have the power
Yeah.
to change your
So,
health, and that you're right about the immune system, and I think how the immune system interplays with the endocrine system, and how these work together, these stressors. And our body has the ability, when it has the tools, when it has the nutrition, and it has the clear pathways, and it's not being blocked by toxins, to actually change our health completely. And
yeah.
I hope that this gave people listening the understanding of that something as a your child is going to be institutionalized can still be reversed. And it's incredible. Like, I'm so thankful for you taking that risk of backing out of your job and figuring this out, and then going back to school to help other people to do it and learn about it. I'm so grateful for you in this world. Thank you so much for helping all these lovely children and people with this situation.
Oh, thank you. That's so sweet. Thank you so much.
Absolutely. Is there any final words you want to throw out to the audience before we go? Any tips, any encouragement? What do you got to say?
Yeah, again, I think just like trust your intuition, as a parent. If you don't feel comfortable with, a medical professional, with the way the school is doing X, Y, or Z, with, medication, with anything at all that, regarding your child, know that that's right. That's okay. And you have the power to say no. And you have the power to choose the path that feels good. And when it feels good, then it's right. I mean, that's how I work. If it feels, if my heart feels good, I know it's the right path, right? If I'm like unsure, No, it's not the right path. Yeah.
Great point. Think of your heart. Because I even think of the people that do everything right,
Hmm.
but they always feel like they're not. It always feels like I'm not doing this right, and they're scattered. And I'm like, wait a second, then just because you're following the textbook of everything you're doing, if you're not feeling like this is a good path and you're giving in to the pressures around you from it, then you're right. It's not connected to your heart. And maybe you're not doing the right thing, even though you're doing everything, quote, correct,
Yeah.
right? Like
Yeah.
all the people that remove all the dyes, great, awesome. We don't want the dyes in there, but they're removing them and they're scattered about it. They're like, oh, I don't know, right? Hold up. If they're not seeing changes, then there's something else there that might need to be done in addition or before it or with it, or it needs to feel good. That's a great, with anything in your health, it needs to feel good and heart connected.
Yeah. 100%.
And we're losing that, our heart, right?
No,
So thank you for bearing yours today. It's been a pleasure. And where can people find you?
so my practice name is Althea Health and Wellness, but you can just Google Lauren Lee Stone, Laurenlee Stone.
Perfect. Well, thank you so much.
Thank
And I'll talk to
you.
you soon.
Yeah, thank you so much.